What up, what up, what up, what up? Welcome to part numero dos, part two of the current state of affairs of COVID-19. All right, we're going to talk about some best practices and to answer some more questions related to some of the things that we're being asked to do as a public. So, first question, what is the most likely way people become infected? Well, the most likely way is not from touching your mail or getting an Amazon package or anything like that, but the most likely way that people are becoming infected is from close personal contact with infected individuals. So if someone's got COVID-19 and you're close to them, or you're helping them, or really you come in contact with them from a high five or anything like that, or you're just too close to them when they sneeze, that's the most likely way that you're going to end up getting it yourself. So something though that's important is that transmission can occur from even people who are what we would say is asymptomatic. So as I said, age is something that causes it to become more severe if you get COVID-19. Well, some teenagers might have COVID-19, but they might be considered asymptomatic, meaning they are not showing symptoms. Even though they don't show symptoms, they could still have COVID-19 and they could pass it on to somebody else. When scientists are looking at people with COVID-19, whether they have symptoms or not, concentrations of the virus can be higher in the days before symptoms even arrive if they have symptoms. So again, this is highly contagious because some people don't know that they have it yet, and yet they're still spreading it. So there's a lot of ways you can become infected. Being around someone who has the illness, but they're not showing symptoms, yet they could still pass it on. Or you could be around someone who's asymptomatic, but that close personal contact is what's going to be the most likely way it's going to get passed on to you. Next question. Why am I supposed to stay 6 feet from other people? Not 5 feet or 7 feet or 8 feet or 6.3256 feet? Well, the reason for this, and if you want to go see a more specific answer to this question, you can go check out that Explore page, go to the SciFlix. I posted a video up there, and you can see exactly what I mean here. But when somebody sneezes or coughs, all that, there's stuff that leaves our mouth, those aerosols and droplets. Well, the droplets, the heavier things, the droplets travel about 6 feet from the individual. So if we stay more than 6 feet, there's a lot less of a likelihood that we'll actually get those droplets that could cause us to get sick. So yeah, that's the 6 feet number. There you go. That's why people are saying stay 6 feet away, because there is some actual science behind it. But check out that video on the Explore page and you can see more about how far aerosols can actually travel. So you might want to stay further than 6 feet. Anyway, why am I supposed to wash my hands so often? And why am I supposed to do it for a certain amount of time and with soap and water? Well, I don't know if you've ever cooked bacon before. Or maybe you've just put some olive oil in a pan to cook up your sweet potatoes or something. Well, afterwards, when you try to get that grease or that oil off the pan, it's really hard to do. But the way that we do it is we use dish soap. And when we have nasty stuff on our hands, we use soap. The reason we do is because that grease and grime, if you were to look at it on a microscopic level, it would look like this right here. These little things are called lipids or fats. And what they do is they coat a surface, and it makes it really hard. They're called hydrophobic, so they don't let water through their barrier. Well, our cells are made out of these, and so are viruses. But if we add soap to this, the soap can actually break this apart. And so it'd be like me using my eraser here, and it can start to destroy this membrane. And if it destroys the membrane enough, especially, then the virus can no longer survive. It can no longer pass on its RNA information, and it cannot infect our cells. So as we use soap and water, what actually happens is we're destroying the membrane of the virus. And the same thing happens when we clean our pots and pans after cooking dinner, is we actually remove all these fats from the pan, and it then is what we call clean. But these soaps can destroy the membranes, and so it's really important that you use soap and water. And also hand sanitizer can do that too. Next question. Why do I need to wear a mask in public? Well, there's actually some good science behind this as well. Let's start not with this diagram, but my second one, which is a little blurry. But the main reason we want to wear a mask is because it helps protect yourself and protect others by you wearing a mask. It does two things. So if we look first on how you can protect yourself, well, if you're wearing a tea cloth even, and there's 100 virus particles out in the air, only 33 of those would be able to get through that tea cloth, a homemade mask. If there was 100 and you're wearing a surgical mask, only 25 could get through, and an N95 equivalent mask, only one of those particles is going to be able to get through. So you can see why those N95 masks are at such high demand, because they do a great job. If you're around a bunch of sick people, they're not going to pass their germs into your mouth, into your respiratory system. And if you are sick, you're also protecting others, because if you were to sneeze or as you breathe, or if you were to cough, there's going to be less and less particles that can actually exit from that mask. So let's say you're super sick and you have those 100 particles. Well, if somebody's wearing a tea cloth, it's going to block about 10 of them. 90 of them can exit. So not very many of them are going to be blocked, but it's at least something. A surgical mask is going to block about half of them, and an N95 mask will only let about 30 of those 100 out of the mask. So by wearing a mask, you're protecting yourself from the outside getting into you, and you're also protecting others because you're not spreading your germs around. So let's look at how effective some different types of masks are. If you look at a surgical mask, the effectiveness against really small 0.02 micron particles, about 89% of particles are blocked by a surgical mask. Now, if we were to add an N95 mask onto here, well, it's called a 95 because it would go here to 95% of particles would be blocked by an N95 mask. What's really interesting to me is that a vacuum cleaner bag is actually the second or third most effective mask that you could do. So if you want to get really creative, you could make a vacuum cleaner mask. And you can think about this: if you were to vacuum up all the particles from your carpet and this had bigger holes in it, then all those particles would escape out of your vacuum bag and fall back down onto the carpet, and you would not end up with a clean house. So that's important. Just a dish towel is super effective, 73%. A cotton blend t-shirt is 70%. And I put the emphasis on the blend because if it's 100% cotton, if it's only made out of cotton, those cotton fibers are much bigger, and so they have bigger holes between them, so that only reduces 51%. An antimicrobial pillowcase is pretty good at 68%. A linen, like a bed linen or a sheet, is 62%. A pillowcase, 57% is blocked. Silk, 54% is blocked. And just a scarf even is 49% blocked. And that's why you see all over the country, people are being told, hey, wear a mask. You know, it might not be the most effective thing, but it's at least going to help you out a little bit. And it's going to help everyone else out too. So it's going to add another layer of slowing this virus down in terms of its ability to get from one person to the next. Okay, let's think long term here. Will this COVID-19 be seasonal, or is it going to spread year round? Well, if we look at these other ones, SARS, CoV-1, and MERS, they are not seasonal. So that is that can be worrisome, because as summer comes around, it doesn't mean that summer is just going to kill this disease necessarily. MERS is actually from the Middle East. That's how it gets its name, ME, Middle East. And in Abu Dhabi, it was over 100 degrees and people were still passing on that MERS virus. And so it's not necessarily seasonal, but there is some hope here because humidity actually helps prevent the spread of the virus. Now let's think about that. In the wintertime, there's a lot less humidity because it's a lot colder, but when it's warmer outside, more water is going to evaporate into the sky, and there's going to be more water particles in the sky. Now, the reason that humidity actually helps prevent the spread of the virus is because if we look in our respiratory system, if I'm drawing our lungs here, our respiratory system actually ends up getting a mucus lining on it when there's a lot of moisture in the air. The moisture helps add mucus to our respiratory system, and that mucus creates a barrier so that if the virus comes in here, the virus has a lot more tough time getting through the mucus to get to those respiratory cells. And so having a humid environment does help. Now that means that if you have a humidifier at home, you should turn that on and start getting some humidity in your home, and it will help your respiratory health because you'll end up getting some mucus in your respiratory system to protect you from the virus. How long will this pandemic last? Well, My crystal ball is quite foggy right now, so I can't quite tell you. But what we could say, or what the scientists are saying, is that it's unlikely to go away or vanish until about 60 to 70% of the population have been infected. And the reason is because if you have a bunch of people and nobody has it, and one person comes in who has this COVID-19, they pass it on to one person, that one person can easily pass it on to multiple people because these people don't have any defense against it. But as more and more people have this COVID-19, and when most people have it, then it's harder for it to actually be transferred because it doesn't know whether or not someone has it. So it might try to pass it to this person and it might get blocked. It might try to pass it to that person and it might get blocked because those people have immunity. So once we have 60 to 70% of the population that have been infected, then it's less likely to spread and then it could die off or quote unquote go away. Now, if we look at this model, again, remember models just give us information, but this is a prediction here in that if we didn't do anything, then we would have a huge spike in deaths. And if I were to draw how much our medical system can handle here, if I were to draw a dashed line here, well, it would definitely surpass our ability for our medical system to be able to help. And so lots and lots of people would die if we didn't do anything. But we've chosen to do some social isolation. So socially isolating people means that less people are going to get it. And that hopefully, some people will not be able to survive this, but hopefully our medical system will be able to handle this surge. And so then there'll be, less people get it as we continue to socially isolate. But at some point, we're going to stop with social isolation so we can get back to, working on our economy, trading services and goods. But when we do that, we're going to have a lot more contact with one another. And so there is a chance that we'll get a second burst where we'll have more people get it in the future. Now, we have to think about the fact that we're currently balancing. It's a balancing act between our economy and money being exchanged and services and taking care of each other, but also taking care of our health and wellness and our healthcare system being able to do that. So we can't overwhelm the healthcare system because then we'll end up causing this teeter-totter to go down. And we can't just let the economy crash either because then our systems, our political systems and societal systems will crash as well. So we have to try to find some balance here in the process. But this is just kind of like looking ahead into the crystal ball. This is what is predicted, is that with social isolation, we might get a bump, and we might even get a bump later on in terms of people becoming infected. But at some point, we're hoping that scientists are hoping that 60 to 70% of the population gain immunity after overcoming this illness. Or maybe we can come up with a vaccine beforehand. All right. I don't want to leave it all gloom and doom here, but I want to give you some advice, kind of how you can move forward. So first off, maintain your cardio fitness. And I stole these from, or I'm borrowing them from David Sinclair. These are some pieces of advice that he had in terms of ways that we can hopefully prevent or at least survive this with less of a detriment to our health. So if you maintain your cardio fitness, then your respiratory system will be healthy. Keep taking your vitamins and your medicines because those are helping you stay healthy and they help your immune system. So anything that's going to help our immune system is beneficial. Our immune system is what will ultimately actually get rid of and kill this thing off for you. Don't overeat, especially sugar, because sugar actually causes your immune system to not be able to work as well. Eat your veggies because those help with your immune system, but also nuts and seeds also help your immune system, and it creates enzymes in your body that can go break down viruses. So those help. Run a humidifier if you have one, because like I said, humid air helps create more mucus in your respiratory system. So humidity does help. Get good sleep. Sleep helps your immune health. And turn off that breaking news. Because that breaking news is just trying to distract you and it can be really daunting for your mental health. So turn off those breaking news channels. Still, you can watch the news, but maybe just do it in a low dose or choose wisely what news you listen to. Instead, go read a book, listen to a podcast, or go make something. Speaking of making something, the Double Black Diamond is going to ask you to do one of three things, and it's your choice. You get to do what you want here. So you could go and investigate the best practices protocol. So maybe you want to think about like, what's the best way for me and my family to go get groceries? Or if we have them delivered, do we have to like leave them outside for 3 days because I've learned that the virus can live on things for 3 days? Well, go investigate that. I've got some resources for you there in the best practices protocol assignment. Maybe you are super interested in the vaccine or maybe repurposing some type of medicine that's already out there, and you want to do some research to figure out what's happening in the medical community in order to try to solve and mitigate the negative impacts here. So you could go learn more about the medicine and share what you learn with us all. Or, as you've all seen, I'm sure, as you've been trolling and browsing all that social media, you could do some content creation. So if you want to go make like some TikToks or some Instagram posts or some face tweet or some snap book or whatever you want to do, or maybe even just a YouTube video to share what it is that you've learned throughout this unit, because now you are an expert. You've learned so much throughout this unit. The goal here is for you to be able to share it with other people, whether it's the best practices protocol, talking about the medicine, how it impacts the body, or just making some content of something else that you learned along the way. So it's your choice. Choose one of these three as you enter the double black diamond. It's been a pleasure. Thank you for listening, and I look forward to seeing what it is that you create.